As we know, doctors all around the world are now in a new area. We are in uncharted territory and learning what to do while on the move. And for the most of us, it's also very scary. We worry about our health, but not the less about how to survive this pandemic professionally. And I would like to talk not about the coronavirus, how to protect ourselves or patients, or about innovative treatments and like that. The whole world of medicine is full of summaries and recommendations. What I feel is lacking is information how to handle the situation, not only so that we survive, but also to exploit the crisis as a chance for growth during and after the crisis, so our clinics will thrive. We have been witnessing a recent increase in distance learning like this one that we are doing right now, but our patients must not be forgotten. We must start to be in touch with them, or otherwise we lose them. In this talk, I want to explore how to deal with the new situation, how to work with the new limitations, and how we can take advantage of the situation to differentiate us from other doctors and get out of the crisis ahead of the pack. Beyond the basic steps that we need to do in order to cope with the new situation, we must take advantage of inherent benefits that we have by having the family solution. We need to take advantage of the fact there is more free time to us to create content and for our patients to consume it and to be exposed to the options that we can create for them. And don't forget that our patients still suffer from various medical problems. And if in the beginning they were afraid to seek solution, as the time passes, there are more and more coming to us to have a solution, and that is not the traditional solution. So we can offer them a safe and effective treatment, not just in terms of medical procedures, but also regarding the corona pandemic. And it's an effective solution. And we know the benefits of this family lift, especially during this time. It's safe, it's hygienic, single use. You can do it in the clinic, spacing the patients and guarantee them a safe environment and great results. So with no further ado, I will start about the presentation about the practice management during COVID-19. I will talk about keys to success during this downturn. I think there are three phases. One is the urgent, what to do right now. The second is the recovery phase, ready to reopen if you're not open yet. And the phase 3 growth, thrive and moving forward from this situation. And if you look according to the Harvard Business Review, during downturns, business that will thrive and get stronger are business who will act early, take long-term perspective, and focus on growth rather than cost cutting. And this is the challenge for us. How can we come stronger than before from this crisis? So let's start from the phase 1, the urgent things that all of us need to do right now. Everyone in the clinics have cancel appointments, and we must make sure that we know which patients are canceled. If there are more serious conditions that we need to tackle more often, or something that we can postpone later. And we can have list accordingly, patients we can treat earlier or later. Second, I found that texting, two-way texting, us for the patients and the patients for us, it's much more convenient during this time. Patient, I found in Israel, and I believe in India as well, prefer texting than to do telephone and other media, and that's enabled them to contact us without coming to the clinic and to decide whether they need to come or not. Third, we must let our patients know how to reach to us in case of emergency, if they want to reach us and they want to ask questions or they need emergency treatments. And we have to define specifically what is emergency. So otherwise they don't call us for any other things that it's not emergency. We have to be familiar with the COVID-19 up-to-date data. And this is a list of websites that you can learn. And I believe that in India you have much more. You can find all around the web. And I think it's important also to divide our patients regarding to the messages that we convey to them according to groups, because there are patients who are obstetric, there are patients who are gynecological, urogynecological, aesthetic. Each group needs a different message, a different attention to them. So it's best to create different types of patient groups and to each patient group treat accordingly. In our time, it's very important to implement telehealth, to expand our virtual office, either by telephone, by text, by image, and to create opportunity to take digital intake, and also to stay connected with the staff, because in Israel, we divided the staff of the clinic into groups in order not to be in constant contact and to be contaminated. So it's a way to be in touch with our staff, and every doctor needs to determine which virtual services he wants to apply to his clinic. Either it's virtual check-in in telephone, texting, e-visits, telephone office visit, telephone calls, any media that you are familiar, and you can apply to your clinic and to your patients, because every country, every clinic has a different patients and population that needs to manage accordingly. It's very important, if patients are coming to our clinic, to send pre-visit instruction. So also the patients will feel safe, and also the staff will feel safe. So we text our patients, if you're experiencing symptoms such as cough, fever, shortness of breath, please let us know, and maybe we'll refer to a later appointment, or we can advise you by telephone or some other media. But it's very important to have this pre-visit instruction and to know the situation. And last but not least, one of the very important things that we need to be aware, to be connected with our patients. We must be present at social media. Either it will be Facebook, Instagram, blogs, newsletter, whatever. I recommend everything that you can do in every aspect. Just a second. Sorry, you're still working. So it's very important to be on the social media, all of the social media. If you have newsletters, send them more frequently. Either it can be information about COVID-19, or more importantly, information about your clinic and how you can help your patients to get through this situation with treatments options, especially for this time. And this is the time that all of us can separate ourselves from the other doctors and to foster loyalty to our clinic. We have to reach out to the community and to help them. If you can get to large business in your area and let them know that you're offering services, that they can share it with their employees. Patients that you know that refer many customers, be in constant touch with them and let them know what you are doing and what you are able to do and offer to other patients, and they will convey this message to other possible customers. And we need to update, if we have auto-response, email or voicemail, we need to update them according to the situation, and update our website as well, because we know about the situation is new and not the old one. Send newsletter, and again, I have to emphasize, engage with social media. This is the very important, the people that, to other people that know we're still working, we can offer them other solutions. Even though it's difficult situation, we can offer them solution. So basically, this is what I think we need to do right away, right now. The second phase can be in combine, or if you're not working at all, when you're ready to reopen the recovery. So we have to create a safe and healthy environment. It means the physical, of course, treatment rooms, waiting room, and with supplies, masks, gloves, alcohol gel, to the patients. We instruct them not to come, if possible, with a chaperone. All the equipment, PFE equipment, all of them are in-house. But also not to forget about the emotional support. We are doing more staff meetings in telemeetings. It's more based on one-to-one, and we are more flexible with the schedules. One hand, because we have less patients, on the other hand, we want to space them to reduce the possibility of contraction coronavirus, and we want our patients and staff, don't forget your staff, to feel as possible as you can. Second, we need to determine our patient priority. Keep patients on the schedule as is if they schedule a meeting. We have to develop priority for scheduling, rescheduling patients who missed appointments. And I think we have to dedicate specific days to treat high-risk patients, to separate from the other groups, and that's the other patients will feel more safe, the staff will feel safe, and we will feel more safe, and to be more flexible with the hours as needed, because right now we see less patients in more time because we are spacing them, so we must be more flexible. We must let know the patients that we are reopening or still working, because many patients think because of the media that everything is stopped, nothing is working. So you have to let them know by text, by social media, anything that you can manage to let them know that you are working or starting to work. Get the patient on schedule. We add, I think 5 is less. We need to 10, 15 minutes extra between appointments to feel more safe and be flexible with cancellation policy. We start to set reminder by texting the patients 3 weeks ahead, 3 days and 3 hours, to see if they still want to come, they want other options by telemedicine, or want reschedule. And that's enable us to reduce the non-show and to be in contact with the patients if something change. We talked about the instruction. It's very important to patients who come to have a pre-screening form at the entrance for possible COVID-19 symptoms. It's very important to have. So after the phase 1 and 2, we are going into the third phase, growth and thrive moving forward. And this is a very difficult situation because we cannot predict what will be the new normal. Because according all of the experts, this situation is going to stay with us for a long time. And what is new for us right now will become the new normal, the standard. So we have to remain focused on safety of the staff and the patients, even if the quarantine will pass, the state of emergency will pass, it will be still with us, so we still need to be on the alert to provide safety for the patients and the staff. We still need to provide patients with more convenient ways to connect with us and to receive care in untraditional methods. And we need to keep open mind to adopt and experiment new technologies, tools, and there's no more, we've always done that. So we need to be more flexible in our connection and treatment options that we can offer the patients, and FamilyLift is one of the options that can be targeted to these times. Again, encourage two-way texting, try to have a paperless check-in process as as you can in your clinic, online scheduling, and it's very important during normal times, but it's more important even in those times. We have to strengthen online reviews. Every patient who got a treatment, even if it was by telephone, by video, by texting, I think we need to ask her, hello, how was the treatment? You are satisfied? I think it's very important that you will convey this message to other possible patients, that they will feel sure to reach us either by telephone, video, texting, blogs, our website, etc., and to enable us to reach more and more patients outside the regular patients that we have. Regarding the family lift, it's a great opportunity to emphasize that we all know about the indications about vaginal tightening, stretching incontinence, vaginal dryness, post-delivery rehabilitation, genitourinary syndrome of menopause, recurrent vaginal infections, vulvar rejuvenation, scar, vulvodynia, lichen sclerosis, etc. Even though we have this pandemic of corona, our patients still suffer from those problems. And they don't stop from suffering from those problems, and they seek treatment solution that will enable them to feel more safe in getting this very calm about the procedure, because it's single-use, hygienic, completely covering the laser probe, and they are very, very happy to know that it reduces the chances of contracting any infection, especially in those days of the corona. You're familiar with the old treatment solution that you can have of the family lift. I don't go through it because you're well expert in this field. So, in conclusion, it's very important to stay safe. Keep protecting yourself and your patient, keep hygiene, but most of all, if we are going to be ready for the new era and that it will be last for a long time, we can also manage to thrive and to proliferate and even to see more revenue in the near future, I believe. So basically, this is what I feel, how can we manage in our clinic this COVID-19 area, and I'll be able to hear from you what you think and how you can implement or add on that. Ankita, it's on you.
A wonderful presentation, Dr. Ronen. It gave us a very good insight. I think many people are speaking. A wonderful presentation, Dr. Ronen.
Thank you.
Please speak. Dr. Preeti, go ahead.
Yeah. It gave us a very wonderful insight, and actually I learned so many things which I need to do during this time. I just wanted to ask one thing, that as FemiLift is an elective procedure, so can we ask our patients to have it done at this time?
I don't ask for the patient. The patient asks me, what can you do for me during this time to help me to relieve my symptoms, because their symptoms, the situation is not getting better for this time. It's getting worse because they are not getting treated. Right. So they come to me and ask them, Dr. Gold, what can I do if I cannot do that and that, and I don't want to go to a hospital and do an operation? And can you offer me something safe that you can treat me and I feel safer with the environment and with the treatment? So if they come to me with the problems, I present them with this solution. And in the beginning, I felt that no one will agree to do that. But as time goes and the situation continues and patients get to know that this situation will be lasting not 1 week or 2 weeks, or even 1 month. It's going to last for a long time. They are more willing to come and have these treatment options. They come to me. How can I help them?
Yeah, wonderful insight. Thank you.
Thank you.
And
Questions? Any questions? If there are any questions, please type it in the chat box.
Dr. Lalita, you could unmute yourself and go ahead with your question, please.
So there is a question. We want to understand how Femilift is helpful in the case of urethral stenosis.
Oh, urethral stenosis, I don't think that Femilift will be able to act on this situation. And on the contrary, I will advise not to treat with a laser on urethral stenosis, not just because it won't be helpful, because if there be any complication, even not related to the treatment, afterwards they will come and say, look, you treated with a laser to the urethra and cause more stenosis or more stricture. So I wouldn't recommend to use the Femilift for urethral stricture. This is not the case for the Femilift.
Okay. Any other questions?
I think if I need to take the take-home message, I think that you need to connect with the patient and be present at the social media as much as you can. This is the time to be there because the patients have time and they are seeking solutions. So this is the time for you to be present at the social media, any platform that your patients are looking at, and push strong on the social media, because this is the key, I think, to survive and to thrive after this pandemic.
Okay. All right. So thank you so much, Dr. Gold, for a very insightful session and sharing all your thoughts and ideas with all our audiences. We thank you for your time, and thank you so much.
Thank you. It was a pleasure, and I hope to see you in person very soon.
Sure. Yes, we look forward to have you in India soon for learning more.
Yes, in Cosginy. I look forward to seeing you all in Cosginy in Chandigarh in October. Thank you.
I hope.
So taking forward